Hi, so this video is about diabetes. So first, what exactly is diabetes? Simply put, it's a metabolism disorder. A person suffers from a metabolism disorder when the chemical processes that maintain life in the body do not function properly. A diabetic person's body has trouble producing or responding to the hormone insulin. The pancreas is the organ responsible for producing and releasing insulin. When one suffers from diabetes, the pancreas produces little to no insulin, or the body does not respond properly to the insulin. There are three types of diabetes: type 1, type 2, and gestational diabetes. Sadly, there is no current known cure for diabetes. Diabetes is a recurrent illness that occurs for two possible reasons: either when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Diabetes is not transmitted from person to person, and it is not an infectious disease. So what is the cause of diabetes? Well, there are multiple types. Type 1 diabetes is caused when your immune system attacks and destroys the insulin-producing beta cells of the pancreas. Specialists believe type 2 diabetes is caused by genes as well as the environmental factors, like viruses, which could activate the disease. The most common form of diabetes is type 2, which is believed to be induced by a handful of factors, including but not limited to lifestyle factors and genes. Someone is more likely to be diagnosed with type 2 diabetes if they are not physically active and are overweight or obese. Diabetes can be harmful to the human body in several ways. It affects the visual system, kidneys, cardiovascular system, and the nervous system. These significant features of the human body can be negatively affected in ways that can harm the body for life. The visual system is affected by high blood sugar levels. These blood sugar levels damage blood vessels and can cause leakage into the retina. The retina is the vision-sensing part of the eye, and if the visual system is affected in these negative ways, it can lead to diabetic retinopathy and blindness. Diabetic retinopathy is an effect of diabetes which could lead to blindness, and according to the CDC, reports from 2005 to 2008, 28.5% of adults with diabetes 40 years or older had diabetic retinopathy. Not only does diabetes affect your visual system, it also impacts your kidneys. In 2011, the CDC reported that diabetes was the primary cause of kidney failure in 44% of people newly diagnosed with the condition. Blood vessels in the kidneys can become damaged from high blood sugar levels, and consequently, if the kidneys become damaged, they will no longer be able to filter blood correctly. Therefore, this blood can result in having a buildup of waste and fluids within the kidneys. Proteins can also leak out of the body through urination. The kidneys are a vital part of the human body, and diabetes can affect them negatively. More significantly is the body's cardiovascular system. The cardiovascular system is home to the heart, which diabetes can damage. Diabetes causes high blood sugar and increased blood fat levels. These high levels of blood sugar and fat cause inflammation of blood vessels. Blood vessels are responsible for blood flow. Therefore, with an increase in blood fat and sugar, the vessels can harden and decrease blood flow. If the blood vessels are negatively impacted in this way, in the heart, it can lead to cardiovascular disease. Lastly, diabetes also affects the nervous system. Diabetes can lead to what is called neuropathy, which is a result of nerve damage. Commonly found in the legs and feet, a numbing or tingling feeling can be a result of diabetes causing one or more of the following: damaged blood vessels, low insulin, high blood glucose, high blood fat levels, and inflamed nerves. After learning about all the negative ways that diabetes can affect your body, I'm sure you're wondering what are some common symptoms of diabetes that I can diagnose myself. Here are some of them: extreme thirst, frequent urination, blurry vision, fatigue, weight loss, tingling in hands and feet, vomiting and stomach pain, lack of concentration, and increased hunger. Approximately 9.3% of the US population is affected by diabetes. This is about 29.1 million affected Americans. Worldwide, 1 in 11 adults has diabetes, creating 415 million people with diabetes around the world today. It is predicted that by the year 2040, 642 million people will be diagnosed with the disease. Even though one may not be directly affected by diabetes, there are several impacts that may surround you. $672 billion, 12% of global health expenditure, is spent on diabetes. Not only does diabetes cost money, but it can cost the lives of loved ones. About every 6 seconds, someone around the world dies from diabetes, leading to a total of 5 million deaths in 2015 alone. There has been a steady rise in diabetes, as it is now the 8th most deadly disease in America. It cost the government $245 billion in 2012. According to Harvard University, the cost has gone up to $825 billion worldwide. In Ohio alone, diabetes costs the government $12 billion a year. Live Science states that by the year 2050, if current patterns continue, 1 in 3 Americans will have diabetes and 700 million adults worldwide will be affected by the disease by 2025. In Ohio, over 1 million people are living with diabetes. 21% do not know that they have it.